Hey, friends. Welcome to the podcast. The patient's voice, does it matter? This is a place where your voice will always matter to me. Healthcare is complicated, so I wanted to create a safe space where we will discuss tips, hot topics, provide resources, have guest speakers who are experts in the healthcare industry, or real patients sharing their patient experience in hopes to help you navigate any healthcare setting. I want to focus on you, the patient, and discuss issues that matter to you in an open and transparent way. I am your host, Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board-certified patient advocate. I have a passion for patients. Let's be the change together. Welcome, everyone. This is part 2 of the 2-part series where we're talking about the basics of healthcare. So once we get our basic understanding out of the way, I will move on to topics that are probably more important to you, share real patient testimonies, and hopefully hear from one of you on being a guest. So the topic today is about diagnostic errors. It's something I see the most of as an advocate, and in my humble opinion, they're the worst that I have ever seen, and they're getting alarmingly worse. So what is a diagnostic error? So the Leapfrog Group agreed on the following definition of diagnostic error. It is an event where one or both of the following have occurred: either a delayed, wrong, or misdiagnosis, or a diagnosis was not communicated to the patient. The accurate diagnosis was available, but it was not communicated effectively to the patient or the family. That's horrific. So I want to explain a little more and give some real patient examples of each of those. So a delayed diagnosis is exactly what it says. You should have gotten your diagnosis earlier. For example, cancer diagnosis is the most common for a delayed diagnosis, because a delayed cancer diagnosis, it could cause your cancer to spread. A wrong diagnosis, just like what it sounds like, occurs when your original diagnosis is wrong or incorrect, and the true cause is discovered later. So I had a client that contacted me, and he stated he was having issues with his lungs, that's what his doctor told him. He was going to his cardiologist, and the cardiologist kept saying, "Oh, go to your pulmonologist, it's your lungs. And so I just asked a lot of questions. Now, I'm not a doctor or a nurse, but some of the things 1 and 1 does equal 2. And after further investigation and questioning, I asked this patient if he thought it was his heart. And he told me, no, my cardiologist said it's my lungs. So I convinced him to please, before we went to a pulmonologist, would he get a second opinion from a different cardiologist? And that's when we discovered that he was given a wrong diagnosis. It was never his lungs. It was his heart. He was in AFib, and his pacemaker had not been working in 3 years. That means the cardiologist that he was seeing had to know he was in AFib and had not checked his pacemaker in 3 years to know it wasn't working. That's a wrong diagnosis. That's a diagnostic error. And then there's a misdiagnosis is when a patient's medical issue is never explained. This is kind of like an example. I had a patient that went to a neurologist, and that neurologist said the patient had a TIA, not to worry about it, wasn't a stroke, and just let him go. And several years later, he had a second stroke. And that's when the patient found out that the first neurologist missed it. He had a real actual stroke. And the second stroke could have been prevented if we hadn't have had a missed diagnosis. So just as in part one, I want to share some references with you and some data and statistics, because you need to be aware of the seriousness of this. It's a public health problem. And I've said this before, and I'm going to continue to say it. In my humble opinion, there's a lot of stuff that's not being transparent to the public. There's no accountability, and there's a lot of cover up. There's a lot of stuff that never makes it to the news. So I feel like it's my job as your podcast host and a patient advocate to tell you what's really going on in healthcare. Per the Society to Improve Diagnosis in Medicine, also known as SIDM, they said diagnostic error is one of the most important patient safety problems in healthcare today, and it inflicts the most harm. They also stated that it is likely that most of us will experience at least one diagnostic error in our lifetime, sometimes with devastating consequences. And that is in their Improving Diagnosis in Healthcare article on their website. And all of this stuff where I reference all this research, it is all going to be available and linked in the narrative, the About section, for you to look for yourself. The U.S. National Academy of Medicine said improving diagnosis in healthcare, it is a moral, professional, and public health imperative. I'm not kidding. It is a crisis, and you need to be aware that there's an article that just came out this year in 2024, in January 2024, that older adults in the hospital, ICU, or in the ICU, the diagnostic errors that are happening are rampant. And if you're not being a proactive patient, and if you don't have an advocate advocating for you, whether it's an independent advocate, a caregiver, a family one, like SIDM said, we're all going to experience a diagnostic error. It's a serious problem. The BMJ Quality and Safety reported an estimated 795,000 Americans die or are permanently disabled by diagnostic error each year, confirming the pressing issue of this public health problem. The top 3 diagnostic errors, they call them the big 3, are vascular events, infections, and cancer. They account for 75% of the serious harm. Other frequent diagnostic errors are stroke, sepsis, pneumonia, venous thrombosis, like a DVT blood clot, and lung cancer. Now, all these topics that I continue to speak of, we are going to discuss those on at length on a different show. So just stay tuned. Like I said, right now I just want to cover the basics so that everyone understands the difference between patient safety and medical errors, harm, and diagnostic errors. Because as a patient advocate, I try to prevent these errors from happening to my clients. And my hopes are that in each episode, it will provide you with the tips, tricks, resources to educate and empower you, preventing you or your loved one from having a patient safety error. Now remember, last episode, patient safety is harm, which includes preventable medical errors and diagnostic errors. So now that the basics are out of the way, we can get to topics that can help you be your own advocate. Next episode is something that is going on really rampant in the United States right now, and it's sepsis. So as I said, there's resources available for this episode that I referenced in the narrative section. And again, this brings me to the end of this episode. I want to thank you for joining me. I hope that all these episodes are bringing value and they're beneficial to you. I appreciate more than you know you listening to the patient's voice. Does it matter? Please make sure you share, follow, subscribe, Make comments, suggestions. I want to hear from you because, like I said, your voice matters to me. And that's what this show is about, is hearing topics that are impacting your life. So, as I said, the next episode is going to be about sepsis. But until next time, this is Krista Hughes, and I have a passion for patients. Let's be the change.